Well, I'm here with Dr. Keisha and Tate, and one of the things, I see a lot of cancer patients, and one of their concerns is always, where am I at in my treatment? What should I do? Or if they finish the treatment, how do I know if I need to kind of step up what I'm doing, or can I kind of coast with the maintenance? Or for people that have, their loved ones that are dealing with cancer, do I need to be worried? So what are some of the solutions? I know that your company Datar really bring a lot of solutions and kind of peace of mind for people in those categories.
We do. Well, thank you, first of all, Dr. Michael, for this opportunity. I certainly appreciate it. And as you mentioned, for DATAR, Cancer Genetics, we offer everything on the spectrum from early detection. So let's say in the case that you just mentioned, a patient, their loved one currently has cancer, but they're concerned that they may have cancer. Well, no problem. We can certainly do a early screening detection test for that. And that test is called Trinetra. And so we are analyzing some cells, CTCs. I don't want to get too technical here, but we are able to diagnose 50 different types of cancers with a sensitivity over 85% and a specificity 96 to 99%.
So you're able to, 85% certainty, know whether that individual is potentially dealing with cancer or not. And then also, if there is, then you would know with 99%
96
specificity.
to 99?
Yeah, to know where it's coming from.
Exactly.
Okay.
Absolutely.
Yeah, which is incredible.
Yes, it is. The
Yeah.
technology is amazing. It's a proprietary system that we created.
And so let's say then that they do find it, and then the next step would be, what kind of therapies would be best for me? What kind of chemo agents,
Yep.
Other type of therapies, and you're then able to kind of match that as well based upon what you're seeing.
Yes, and so the other tests, we offer 6 different tests. So we offer a screening test, a diagnostic test, and I can break those down if you like, and 3 therapy guidance tests, and then a remission monitoring. But specifically with the scenario that you just mentioned for treatment. So let's say that one patient came back and it was confirmatory for cancer, positive, we can move into treatment guidance. And treatment guidance looks like we have a panel that's called Chemo Scale, and we have clinically validated 40 chemotherapy drugs, 32 natural therapies or repurposed therapies, and we, with a simple blood draw, can determine and provide a report to the provider that indicates which drugs are effective for that patient. And so it really is revolutionary because standard of care, what we do, we treat based on types of cancer. Here we're advising you and giving you a report that will allow you to treat based on that patient and their specific cancer cells. And so it really is exciting. It's technology and tests that should be made available to every single person. We are in 40 countries. We have processed over 1 million blood samples. And so we've been in this space since 2010. So we're doing good work. Yes.
And what kind of results have you seen with people then using this technology, compared to people that don't?
Right. Well, we're producing better outcomes because it's specific, it's precision cancer care or medicine at its finest. And so we are removing or allowing speed to care. We are removing the trial and error and the guessing game. I personally am excited to work for this oncology laboratory, DATAR, because I have a personal story. My sister was diagnosed with breast cancer, and I just watched her go through more than 30 rounds of chemotherapy, failed chemotherapy, metastasis breast cancer that went from breast to lung, liver, brain, spine, to all over her body. I saw her witness with my own eyes go from a very vibrant, beautiful, loving person to wheelchair bound, unable to speak. And so I was determined that I was going to find solutions. I couldn't save my sister, but I am on a mission to make sure that this technology is available to every single medical student, every single patient, every single provider in the United States. We have, people in other countries making sure of the same thing, but it's my passion, my mission to go to medical schools. It doesn't matter the type of medical school, but we should be doing this. We're doing so much harm by blindly giving the same chemotherapy for every single patient that presents with triple negative breast cancer or prostate cancer. And we're doing a disservice. And we see that those numbers, I can quote all kinds of statistics, but we know the numbers. They don't produce consistent outcomes. The success rate of chemotherapy standard of care is less than 30%. Why are we continue to do the same darn thing and getting the same results? We need to change. There has to be a paradigm shift.
Yeah, I mean, what was that study they did that, compared to doing nothing versus them bringing in the traditional oncology care, it extended a person's life by like 3 months.
Right.
On average.
Right.
So.
Right.
Yeah.
3 months. I mean, let's do some years. And so I've been in this space for about 2.5 years now. I've seen patients who came to us, who were introduced to Datar, who had 6 months to live, and 2 years later they're still here. And I still get text messages. It brings me joy and tears and goosebumps when I receive those text messages saying, "Your test saved my life. I went to my oncologist. I introduced your test and your company to my oncologist. They're now using your test and your reports to save lives." That is, I could do a backwards flips, but I may not be able to get back up. But that is just exciting. It's just so impactful. It's so meaningful.
Well, I mean, and I'm so sorry to hear about your sister, and you always, you always look back and look at, I wish I had this then.
Or I wish I had that knowledge, because I knew nothing about precision medicine, nothing about liquid biopsies.
No.
I didn't know this technology existed a couple of years ago.
And let's move on further then. So you have the individual that are now no evidence of disease, and I can't count how many patients they come to me. They went through their cancer journey. Their oncologist says, there's no evidence of disease, and then all of a sudden they're just kind of let loose. They have no idea, where they're at, and
Right.
So talk to me a little bit about that.
Yeah, so that's a great point. I do see patients all the time who've had surgery or radiation, and the provider says to them, "We got clear margins, and you're good." What does that really mean? And so those patients, we offer a test called remission monitoring. And for those patients, we're able to detect both CTCs and DNA. And before cancer is even visible on imaging. And so that is the beauty about the technology. So I have some patients that on an annual basis, they have this test done. I have some patients, depending on the type of cancer that runs in their family and or they were exposed to, they have this test done every 90 days. And we are able to detect cancer before it shows up on imaging.
Yeah, which is huge, because that's always the question, how aggressive should I be in my maintenance protocol?
Exactly.
And obviously, a person doesn't want to take a bunch of pills or do a lot of therapies if they don't have to.
Correct.
Because in addition to, it being costly, it's just people get pill fatigue, they get therapy fatigue, and they want to be able to dial that down. And then to have something that is able to monitor them.
Absolutely.
And then know, I got to step up my game at this point.
Absolutely. And to add to what you just mentioned, they don't want the radiation exposure. They're tired of it. They've had it from PET scans, they've had it from MRIs, and they're trying to get better. And so that continued exposure, we know the effects of that. So
Yeah, great. Well, Dr. Keisha, this was beautiful. You're bring light and joy and love wherever you're at, and to bring that into this space where people really need it. That is wonderful.
Thank you so much for this opportunity.
Thank you.
I appreciate it.
Thank you.
Thank you.